Hello, and welcome back to A Day in the Life of podcast with me, TANYA Hassan. In today's episode, hear from dermatology physician assistant Kelly Swanson. Kelly shares her story to discovering the PA profession, her day-to-day as a dermatology PA, and a look into some of the most common cases she sees. We also chat about the diversity of careers in healthcare and how the PA profession differs from a nurse practitioner or a physician. Lastly, Kelly offers us a glimpse into PA school as we chat about ways to make your application stand out. And without further ado, let's get into the episode. Hi, Miss Kelly. Thank you so much for coming on my podcast today.
Thank you for having me. I'm so excited.
Same here. I'm really excited to dive in and learn all about the PA profession. So getting started, can you tell my listeners and I a bit more about what made you want to go the PA route? Is this something you always wanted to do from a young age?
So actually, funny story. I went to art school when I graduated from high school. So certainly did not know that I wanted to be a PA since I was younger. I thought I was going to go into fashion design. And so I lasted for about 6 months in art school and decided that it probably wasn't meant for me. And then I transferred to Western Michigan where I majored in dietetics. So I was going to be a dietitian. And then once I got into more of those kind of like medical based classes, I thought I was a little bit more interested in that field. And I will be very transparent. I wasn't even sure kind of what a PA was. So my mom had told me to kind of look into it. And I think it's perfect for me. It provides a lot of flexibility. You have a lot of, autonomy and independence, but it's also kind of nice. Like I love being part of a team versus I'm much more of a follower versus a leader. So I think PA offers that, but it's also, like I said, it's just being kind of part of that whole team. It provides a lot of flexibility. Lifestyle is amazing. So it just has a lot of benefits.
Yeah, definitely. The PA profession is super versatile and it's definitely a really, really great fit. And so I know a lot of people interested in healthcare kind of are deciding between like doctor or PA. And so, like, for you personally, what made you decide to go the PA route?
That's a really good question, and I get that a lot. So I always tell people I never really wanted to be a doctor. It just, I don't know, it never really crossed my mind. I love the PA profession. Like I said, I just enjoy that we're able to, have a lot of flexibility. So you get trained in 8 different specialties when you're in PA school. But then if I woke up, so I'm in dermatology, but if I woke up tomorrow and I decided that I wanted to go into pediatrics or plastic surgery or something like that, I could just switch, which I don't think a lot of people understand about the PA profession. So that by itself is definitely a huge bonus. At the end of the day, I mean, we're all in it to help people. PAs also, I think, provide an increased access to care and maybe availability that patients sometimes will wait months to get in to see a physician, and we might be able to get them in a little bit quicker, and obviously coordinate with our supervising physicians to discuss if it's an emergency case or an urgent matter, but at least to provide them an increased access and availability, I think is a huge bonus. The flexibility, the lifestyle, those are definitely perks for me, and I think a lot of my colleagues feel the same way in the PA profession.
I love that you brought that up. And, about the point on, being able to switch specialties and the flexibility that it allows. Is that something just like if you want to switch, you kind of go through like a little training program, or how does that work?
I'm sure there would be some type of kind of like, more like on the job training, I guess it would be, what I would refer to it as. We train, obviously when I was in PA school, which seems like ages ago at this point, we trained and we rotated through those specialties, but most of what I learned, even in my current job, I learned on the job, and I trained with my supervising physician for 6 months before I even, frankly, touched a patient or saw a patient by myself. So I'm sure there would be a little bit of a learning curve and training period if you were to switch specialties. But that's kind of cool too. I think it provides like endless learning opportunities too. So it's never boring. And if it starts to become boring and you feel a little bit content in life, I think it's always kind of nice to have the option to switch it up.
Yeah, definitely. Experience is so important. And then just in healthcare, like you said, learning never stops. So that's really important.
Yep, for sure.
And then I know like another big one that people kind of decide between is like PA versus NP. Was that something that you were ever in between as well?
Not quite. Only because I don't have a nursing background. So I have the dietetics background, and personally that major kind of set me up pretty well to meet the prereqs for to go to PA school. So I had to take dietetics is very science focused, so I took a couple extra like psychology classes that I was missing. But aside from that, right then and there I met the prereqs for PA school versus to go into NP school you have to be a registered nurse to begin with. Both I think are awesome specialties, and I don't have any problems with the NP profession. I think, like I said, there is a room for all of us in the medical community. It's a little bit of a different learning model that I will be very honest, I can't speak to exactly what their training is. But like I said, ours is just a little bit different, and that kind of brings up the point of a lot of PAs have very kind of broad backgrounds. In my class in PA school, there were, retired teachers or previous teachers, I should say, architects, exercise science. So it was kind of cool to see all these people from different backgrounds kind of come together with one common goal to be a PA.
Wow, yeah, that's super cool. And then kind of rewinding a bit back to undergrad, can you tell us a bit about where you went, a little more about your major, and also a little on the application process?
Yeah, for sure. So when I went to Western Michigan University for my undergrad, and I majored in dietetics, I set myself up to graduate in 3.5 years. So I took summer classes, and I don't know why I was in such a rush to graduate, but I was. And so then, the more I got into the program, so dietetics, that has a lot of medical components to it. And so as you get further into the curriculum and into the program, the classes became not just about, the food pyramid and what you should eat, but it became very like medical focused. And so the, more advanced classes towards the end of your degree were definitely more like hospital based. And that's where I felt like I was really starting to get a little bit more of an interest in. I think dietetics is an awesome profession, but I kind of felt like it would leave me wanting a little bit more. And so that's when I started to look into the PA programs and kind of see what the prereqs for those would be. And so I ended up staying at Western for a whole nother semester to do those remaining classes that I had to take. So, like I said, it was a couple of psychology classes, maybe one more biology or some type of science class. And so then I actually PA programs are pretty competitive. And not only do they require you to have the curriculum or the prereqs and obviously do well in those classes, but a lot of them, and I know this has even changed since when I applied, like 10 years ago at this point, to patient contact hours. And so I didn't necessarily do a ton during my undergrad, aside from just like normal kind of like community service types of things. I was in a sorority, so we had a lot of philanthropic opportunities, but I didn't have a lot of like one-on-one patient care. So I actually worked as a medical assistant for an entire year after I graduated from undergrad, kind of while I was applying to PA school. And then CASPA is kind of like the kind all-encompassing program where you're going to see all the PA programs. You apply to the PA programs through CASPA. And so you can go on there and see the different prereqs. And I'll be very honest, I kind of cherry picked the programs that I met the prereqs for. So I think I ended up applying to somewhere between 5 and 7 schools, which that's kind of my sweet spot for me personally when I recommend people to apply. Just because, I mean, honestly, it gets to be pretty expensive when you're applying to different programs. And generally you should be able to get into, if you're a good candidate, you will get into one of the 5 to 7 programs that you apply to. So every program is different. Obviously, CASPA kind of has their like overarching application that you go through there. And then each program might have supplemental essays that you have to write. So if I remember correctly, I submitted all of my applications in the August, so kind of the summer, towards the end of the summer after I graduated. And then, nope, that's probably wrong. I probably worked and then submitted them and then started the interview process. So that's the other thing, once they look at your applications, then they'll either say yes or no. And yes means that you get accepted for an interview. It doesn't mean you get accepted into the program, but then you go in for an in-person interview. And then thereafter is when you find out whether or not you were accepted.
Oh, thanks for that really comprehensive walkthrough. And like you said, PA school, I mean, it's just getting, so competitive with, a lot of people are really liking the profession and it's just become so popular. And so what would you say is something that made your application kind of stand out in that process?
That's a great question. So, and I always tell people, and I'm trying to really go back to what I had in my essays or anything like that. But I always tell people, do something unique. Everybody's going to have good grades when they apply to PA school, obviously, but do things that make you stand out. So this isn't necessarily as much for myself, but now that I've been working, obviously I work with a lot of medical assistants that might have the same path that I had. And so I read a lot of their essays and try to help them, along the process. And there was one of our medical assistants actually just got into PA school at the end of last year. So I can remember her essay probably a little bit better than I can recall my own. But she wrote about this scuba diving experience actually, which it's kind of hard. It's like, well, what the heck does that have to do with the PA profession? But it was kind of how she had a really bad experience when she was scuba diving, and it could have led to a terrible accident where her equipment was malfunctioning. So it was about, how did she troubleshoot and, kind of calm down, critical think through that whole experience. So it doesn't always have to be like medical focused. Great if you have, experiences that maybe you can tie in, but obviously there's a lot of critical thinking. There's a lot of instances like that you're going to be encountered with in the PA profession. So I thought that was a really, really cool, unique thing. And I'm sure it set her aside, when these committees are reading through hundreds of applications, probably thousands of applications, what makes you stand out. And like I said, sometimes that might not have anything to do with the actual PA profession. I think if you want to kind of zone in and really focus on the profession itself, the underserved population is always going to be something that, frankly, that's kind of the one of the main, I'd say, cruxes of the PA profession, is how can we reach out to the underserved populations that are kind of being, not, I don't know if neglected is the right word, but they need care. And so maybe you did something where you even volunteered or did community service to help those types of populations, like I said, that aren't generally thought of when it comes to receiving the care that they need.
Yeah, I really love that, and I think it's so important to hone in on that perspective and those kind of experiences. I think that's really great advice. And so now moving into PA school, how was that first like for you? Because I've heard that with PA school, even though the duration is a little shorter, it's a ton of material all crammed into the few years, and so I just wanted to kind of get your insight on that.
For sure. And so most PA programs will vary anywhere from 24 to 27 months. I went to the University of Toledo, so that was a 27-month program, where that was 15 months of classwork and then 12 months of rotations. And so, it's not complete medical school. I don't love when people use that comparison. It's a lot of the same curriculum, jammed into 15 months. The other thing that I think is kind of unique is we had 32 students in my class. So I thought that was awesome. It was like your own little family for, practically 2 years. The beginnings of it, I'd say for the first probably, I don't know, 2 months, maybe I cried very often. And I can remember saying, I don't know why anybody would go to PA school because it seemed like the worst thing that you could possibly do. But it was, 8 hours of sitting in a classroom or obviously, working in a cadaver lab. And then I was very fortunate. I always tell people, when I was in PA school, that's all I did. I was in Ohio, so I wasn't around my family. My boyfriend obviously was still in Michigan, so I didn't see him at all. I didn't work. It's actually, I don't even know if any program allows you to work when you're in PA school because it is so grueling. But you go to class, you sit in class all day. I came home, maybe ate dinner, and then studied, went to bed, got up, and I did it again the next day. But once you get past it, I mean, you'll figure out kind of, study habits that work for you. Some people like the group setting. Other people obviously are more individual learners. But once you kind of got the feel for it, it actually, it was, I look back on it now, obviously, like I said, 8 years later, and it's like, gosh, it's probably some of the best years of my life. Just so much fun. And like I said, you kind of develop your own little family. And I have probably 4 or 5 of my solid best friends still to this day from PA school. And then, once you get past that curriculum year, rotations are definitely they're hard as well. And every rotation is different, which is kind of nice. It's a month. And so if you have the world's hardest rotation, which for me was probably the ER, also cried a lot. Just 12-hour shifts. I am not somebody that functions in 12-hour shifts. But it's a month. So I always tell people you could do anything for a month, but that kind of, you're separated from your friends for a whole month, depending on where you're rotating at. I did a lot of mine in Michigan and they were in Ohio. And so then at the end of the month, you come together, you do your end of rotation exam back on campus. So it was a lot of fun. And like I said, a ton of work, probably the hardest 2.5 or whatever, 27 months of my life, but also the most enjoyable.
That's really great to hear. And I think it's so cool, your class size. So that way, I
Yeah,
think it's really nice that you're able to kind of get that attention. And then also, like you were saying, kind of build those long lasting relationships with other people.
for sure.
That's really nice. And then now kind of getting into kind of like current day and, in the dermatology realm, what made you want to specialize in dermatology specifically?
So it's kind of funny. I went to Toledo and I actually got a scholarship to go to Toledo. And so the one of the bigger stipulations of the scholarship is that they kind of picked your elective rotation for you. So I did 2 mental health rotations in PA school and I didn't ever do a dermatology rotation. I just always was interested in dermatology. And looking back 8 years ago before I even got into it, I don't think I had a great answer as to why I liked it. But getting into it now, I think I can answer that question much, much better. I love the lifestyle of it. I love the office aspect. And, generally you're working 8 to 5 pretty traditionally. So you have, to me, that's comfortable. I have best friends that work in, ER and cardiothoracic surgery, and they can't fathom working, that same shift every single day. They're 12-hour shifts. They love their night shifts. And so it's everybody is a little bit different, but dermatology, it literally has everything I could offer where it's, a variety of cases. I once did a rotation and I had mentioned to somebody that was working at the urgent care that I was at that I wanted to go into urgent care, or excuse me, go into dermatology. And she said, why, that's so boring. And so that kind of left a weird taste in my mouth. But looking at it now, some days are acne and warts and that's completely fine with me. But then other days you'll see a rash that you have no idea what it is. And so there's endless, similar to what I said earlier, there's endless learning opportunities. That dermatology is so complex. And I work in a very I would say, we call them the worried wells. So there's not a lot of really, really, really crazy rashes that walk in, but you will see, things like I said, that you don't know what they are. And so that's where there's always an opportunity for me to learn more. Patient population. I love derm because you'll start to develop relationships with your patients where you'll see them, every 3 months or 6 months. And I've seen, children, I've seen their parents, I've seen their grandparents. So it provides a little bit of like longevity where you can start to really build relationships. And I consider, some of these patients, they've become actual friends to me. So that's a really cool thing. You could specialize in cosmetics if that's something that you're interested in, and I have friends that do that. You could do surgeries, so skin cancer surgeries, easy excisions. You could just do medical dermatology if that was what you were really interested in. And then obviously you can do kind of dabble in a little bit of all of that. So I always tell people I do about 85% medical dermatology. So that's your acne, rashes, skin cancer, screens, but biopsies, simple surgeries, that type of thing. And then I'll do about 15% cosmetics. So those are your injectables, mostly, Botox, neuromodulators, that type of thing. And then a few fillers. But I go to conferences every single year and I come home just like my head is spinning because there's so much information that, again, it's endless learning. And I love that. It's never boring to me at all.
Wow, yeah, I love seeing, the love for learning that you have, and just by hearing you talk about it, I can really, see your passion shining through, and it's so cool that you're, doing what you love, and that's really awesome. So, can you give us a little bit of a walkthrough of like the typical day in your life, and how that looks, kind of from start to finish?
For sure. So, and it really, I would say most days are pretty routine, where, like I said, we started around 8 o'clock. I have generally two dedicated medical assistants that work with me. Shout out to them because honestly, anybody in the medical field knows that I couldn't do probably 90% of my job without them. And so, it's not necessarily the same every day as far as what you're seeing, but we'll do skin cancer screens where generally you're just, following up with patients, looking them over head to toe for skin cancers, abnormal moles, that type of thing. You'll see acne visits and then some procedures, whether that's, even like warts or biopsies. And then we have a pretty traditional schedule where you'll work, 8 to noon, you'll break for lunch. Hopefully you can squeeze a lunch in there. I try to do a lot of my social media at lunch where I'll kind of, get on. I like to post something. That's something that I started to do kind of over quarantine of creating these social media platforms just to kind of educate and entertain. So I try to do some of that work at lunch some days you just need to, step outside and sit there and not do anything for 10 minutes. And then the afternoon is pretty similar. Sometimes we'll squeeze in surgeries, which if we do, I kind of like it. It breaks up the, sometimes monotony of the day. We schedule those a little bit longer, obviously. But then in the evenings, I'll stick around probably for anywhere from a half hour to, sometimes an hour signing off on charts. That's also where I'm very spoiled. This isn't the same in every office, but our medical assistants scribe. So that's something where yes, I have to sign off on charts, but it's significantly less than having to dictate by myself. So again, forever grateful for that. So I'll sign off on my charts, review them, review biopsies, sign off on path reports, and kind of decide, if patients need treatment for their skin cancers, what that's going to be. And then I'll, obviously, like I said, try to come up with some social media content for the day. That's, like I said, I think that's a pretty routine day. And obviously, so my practice has 4 physicians and then myself. I'm the only mid-level in my practice. And then out of the 4 physicians, I generally work with one supervising physician. So I'll, obviously if I need her, she's there every day. I can kind of grab her to discuss a case or have her come see a patient with me if that's, something that I'm not comfortable with. That's the other thing that I always stress to people is you have to be comfortable being uncomfortable and not knowing what to do sometimes and not being afraid to ask. Humility is a huge part of being a PA, and you don't know everything. And I think that's something that I kind of pride myself in is I don't try to know everything, and I'm very content. And I think I do a pretty good job of knowing what I don't know. So that's where I like asking for help. I like learning from other people. So if I'm not 100% confident on something, she's literally a few steps away down the hallway. So I can always grab her to pop in and take a peek at the patient. And obviously, like I said, I love to be able to learn from them as well,
Yeah, that's a really important point. Help your learning as well.
for sure.
And then I also just wanted to add, on the social media, I love your like Instagram reels. I think they're like so, cool and entertaining, and then also really informative at the same time. So those are
Thank
definitely a
you.
really great resource.
Yeah, it's definitely something. I mean, everybody seems to be kind of tapping into that, but education and even like medicine, it doesn't have to be so dry. So I think sometimes that's where it's like, yeah, it is a little bit nice to kind of laugh about some things that, again, we're all going through on a pretty, consistent basis, especially in the derm community.
Yeah, definitely. It makes it really fun.
Yeah.
And then lastly, just a little bit about kind of now switching gears to students. What advice do you have for students who are wanting to follow the PA route, just in terms of looking ahead at colleges that may offer an accelerated route, or even just, courses to focus on, or any extracurriculars?
That's a good question. And one that I get a lot. So, and I always tell people, and this is obviously speaking more from the PA versus NP, like we talked earlier. So, major in something that you enjoy. Like I said, when I went to art school, and I still like art. I don't do it a lot, but do something that you enjoy, because you'll see, and I think like kind of piggybacking off of what you said, look at some of the prereqs for PA school, and see if you can kind of combine what they're requiring with something that really interests you. So sure, it's easy to do biology or pre-med, that's fine, and some people might be really interested in that, but I think there's a huge value in really enjoying what you're studying, which will kind of make it easy, I think, for instance, to do well, and to be motivated to study and to learn. But then obviously getting more into, because I assume, I don't know, maybe I'm assuming wrong, but if you're applying to PA school, chances are you have good grades. That, I guess that's maybe, just something that if you don't, try to really work hard on. But extracurriculars, I think, probably get a little bit more weight when it comes down to, actually getting to the interview process, the applications and the interview process. So do fun things. Yes, if you want to join your pre-PA club or the PA club, those are great. Definitely, I think those are for certainly something that people will take into consideration, but do something fun. I joined a sorority when I was in undergrad, which sororities kind of get a bad reputation, but he provided a lot of opportunities to do community involvement that had nothing to do with medicine, had nothing to do with the actual PA profession, but it really made me, I think, a well-rounded candidate for a PA school. Um, and again, I don't know that I would push the accelerated programs. I can't speak to them, but I always tell people, I mean, like I said, when I was in such a rush to get done with undergrad, and then it came time to finish in 3.5 years, and I kind of panicked, and I don't regret staying for the extra semester. And then same thing with PA school. I look back, and those were some of the best 2 to 27 months that I had. And I love work. I think being a PA is awesome, but I'm going to work forever. So, I always say enjoy the ride, have fun along the way, and yeah, make good choices, try to get involved as you can, but don't stress too much that it always has to be so, medicine and healthcare focused. Do things that you really enjoy doing.
Right. Yeah, totally agree. Having that balance is really key.
Totally.
And now, just wrapping things up a bit, I'd like to go into a little rapid fire round of questions so my listeners can get to know you a little bit better.
Cool.
So the first one is, what is the best thing that has happened to you this week, personally or professionally?
Ooh, actually this was a bad week. So this was the highlight of my week for sure, being able to come on here and chat with you.
Oh, that means so much. Thanks, Miss Kelly.
Yeah.
I've really learned a lot, and I'm just so excited to, be able to share this with others too. And so doing this is really so amazing to get to hear from people like you who have, all this amazing advice to share. So thank
Yeah.
you.
Oh no, this was so fun.
And then the next one is, What is your number one go-to skincare product?
Ooh, I'm between two, honestly, and I always tell people they're kind of cousin brands to them. So skincare product would absolutely be sunscreen. Skincare brand, CeraVe, La Roche-Posay, those are my go-to options that they have amazing, just basic, affordable skincare options that, I mean, anywhere from moisturizers to cleansers to sunscreens to more of your, anti-aging products, that type of thing. So sunscreen, absolutely my number one skincare brand or my skincare product. But the brand CeraVe, La Roche-Posay would absolutely be my go-tos.
Oh, nice. Yeah, they definitely have a lot of variety. And then what are you reading or listening to right now?
Am I reading or listening to? So, Dermcast, I'm trying to think. I'm probably more of a podcast person. Dermcast TV through the Society of Derm PAs. I think their little tiny kind of quick podcasts are probably my go-to just to be able to kind of, learn a little bit more. They'll highlight some different skin conditions or unique cases, that type of thing. So Dermcast TV is probably my go-to, and then totally just unrelated to medicine because sometimes I just like to come home and not think about anything. I just started to watch the third season of You on Netflix.
Oh, nice. I'll have to check Dermcast out. That seems
Yeah, no, it's the Society of Derm PAs does a really nice job. I think they have really good tools and I would say references, both for new PAs, but also people that are interested in getting into the PA profession.
nice. And then the last question is, if you were not in dermatology, what other specialty would you be in?
I always tell people I think it would be a toss up between OBGYN and plastic surgery. So, OBGYN, because it has a very similar office setting, I think, to dermatology. So, more of like the gynecology kind of side of that. And then plastics, because it has, probably most similar to what we're normally seeing more from the surgical aspect of the derm world. But both, like I said, I could see myself in either of those. I also don't know if I see myself leaving derm anytime soon either.
Yeah, yeah, definitely. Derm is like it's a really rewarding specialty.
Yes.
Well, thank you so much, Miss Kelly, again for coming on the show. I had an amazing time chatting with you and
Oh, thank you. This was
thank
so
you.
fun.
Yeah, I loved hearing your story. And I can't wait to share it with my listeners. Thank you
Absolutely.
so
Thank you
much.
so much.
Thank you so much for tuning in to today's episode. Be sure to subscribe and leave a review. I'd love to know what y'all think. To learn more, check out my Instagram and YouTube at Finlit for Teens. And if you're interested to hear from a certain profession, feel free to DM me so we can get them on the show. Thank you again and see y'all soon.